Everyone. I'm Alexandria Callahan. I'm the manager for the Behavioral Health Department at City of Hope in Chicago. And I am accompanied today by,
Cynthia Ingram, and I am the asexual health nurse.
so today we are going to be speaking about body image and intimacy changes, predominantly around the young survivors with metastatic breast cancer. So as we begin, we're jumping in to look at the various emotions and responses that patients may have as they're navigating through cancer, and even to focusing on how the recovery of that impacts them. As we know, with a lot of cancer diagnosis, there's a tons of unknowns, feelings of being trapped, even in their own body. I've had a lot of patients say that they feel disconnected from themselves, or they don't even really know, what's happening on anymore in their bodies. A lot of times they'll start to isolate from themselves. There's a sense of panic, a lot of increased anxiety, even changes of sleep that correlate with that anxiety or the stress related to their diagnosis. Unhealthy habits might start emerging. Even, binge watching TV, drinking an extra glass of wine or two. Some people start smoking. So there's a lot of changes that we might go through when we're trying to cope with that diagnosis and the changes that happen as a result of it. And of course, there's a lot of worry and a need for grieving. A lot of times we miss this component, and it's a very important one to look at and say, okay, I've gone through a lot of changes. My body's changed. My sense of self has changed, and I need that time to grieve all of that. So as we look at the impact of the diagnosis, we definitely talk with our patients about the traumatic experience that it has on your body and your mind. A lot of our patients go through that fight, flight, freeze, or fawn response. Typically, there's more of that fight or flight reaction in there. But that freezing is that numbing of emotions. The fawning is kind of doing whatever you can to appease, your family, the doctors. Focusing more on that fight or flight, we look at, people's, attitude and saying like, okay, I have to just push through and I can't feel those emotions because I've got to fight till the end. That flight response, though, happens too. We've had quite a few patients that have denied their diagnosis or ignored it, just so that they didn't have to deal with it. We know too that all of the treatment options, surgery, chemotherapy, radiation, all impact our bodies. There's the typical hair loss that happens with chemotherapy. There could also be changes in skin pigmentation, weight fluctuations. Some patients lose a lot of weight, some gain weight, especially if they're on a steroid, they might find that they gain weight. There might be fluid retention. And then certainly to surgery, having part of your body removed, there's going to be scars and constant reminders of everything you've gone through. A lot of our patients experience perspective changes as a result. They're looking at their future plans and questioning, should I make plans? Or, now that I've gone through cancer, are these things really important to me? And that's really where that reevaluation of what is most important comes into play. We also know that pain and increase in stress are two major things that happen with a cancer diagnosis, along with that anxiety that I mentioned earlier. When we look at stress, we know that it affects the entire body systemically, that body, mind, our emotions, and behaviors. So this is where some of those maladaptive coping skills come in with that emotional response. Our bodies might feel a little bit more fatigued. You might have headaches or muscle aches. It also impacts your mind, where there might be impaired judgment or just difficulty cognitively computing things. And then certainly our behaviors too. Everything is connected in there. And your emotions will be a little bit more raw. You might not be sleeping as well. So it is looking too at how can we manage that stress, which also impacts your immune system. Our relationships are also impacted. So you might find shifts within your relationships with yourself and with others. So changing of roles happens a lot, especially if you're fatigued from treatment. And even after treatment, I've had a lot of patients say, I look the same, but inside I feel different, and my family doesn't understand that. A lot of patients too question, their sense of meaning or, how they identify themselves. If they were working and doing a bunch of activities and that shifted now for them, whether it's temporary restrictions or a complete lifestyle change, those are all things that need to be looked at. And that goes with, our energy levels, our mood, our motivation, going back into those emotions, the anxiety and depression that occur. And with those fears of the unknown, is the cancer going to come back now that I'm on the flip side of that? And uncontrolled pain is another huge piece that impacts our patients and something that hijacks your entire system. Also, too, socialization can shift. If you're tired and you don't feel good, the last thing you want to do is get all dressed up and go out. So that's also something to keep an eye on and say, okay, am I restricting myself from doing everything, or am I finding a nice balance in there? I'm going to transition now to Cindy, who is going to talk more about supporting your sexual health.
I'm going to talk a little bit about the healthy body and mind. So you want to get to know yourself again. You're going to feel different than you used to feel before. And this is the new you now. You want to eat and move your body within the limits of your abilities. Different days, you're going to feel differently, so you'll have different limits. Look better, feel better. It boosts your confidence. Try to do at least 10 minutes of exercise. Maybe that's just walking or stretching, yoga, dancing. 10 minutes will make a difference. Eat foods that nourish your body. This helps you heal. And think about the 80-20 rule. Wear clothes that make you feel good about yourself. Maybe you lost weight, maybe you gained weight, but you want to have one or two outfits where you feel really good in. Focus on yourself now, not your pre-cancer body, not your pre-cancer energy. Maybe you have pictures of yourself where when you look at them now, it upsets you. Put those pictures away for now and think about what's happening now. Quality connections, surround yourself with people who can be honest with you. They boost your spirit. They make you feel safe, respected, and supported.
Tell them what the 80-20 is.
Oh, 80-20 rule. I talked about that briefly. That means 80% of the time you're going to eat for health, and 20% of the time you can eat things that you wouldn't necessarily think are healthy, but that you're craving. Intimacy. The power of touch, maybe a hug, holding hands, a gentle massage, cuddling with your pets. Explore what feels pleasurable, alone and with your partner. You want to reclaim your body with confidence. The change to your body is the way you see yourself, which often influences how we feel about ourselves. Self-touch, massage, learn what feels pleasurable again. Sensate focus is a process where you explore what feels pleasurable, different sensations in your body. Exploring the genital area is off the table, so sex is off the table. And you're noticing what feels good to you and what maybe is even arousing to you. What you would do is take turns with your partner. So 10 minutes you're receiving, and then the next 10 minutes you're giving. Maybe you have a soft gaze, or maybe you're wearing an eye mask if you're comfortable with that, just so you can actually explore what the different sensations are. There's also a sex menu by Dr. Stephen DeWitt that offers a variety of different sexual and intimacy options. And so you can look through that with your partner and see what you feel is good for your relationship. Intimacy versus sexuality. Intimacy doesn't have to lead to sex. Discuss how you feel with your partner. The sensate focus practice that I talked about helps you discover the sensations of sensuality, oftentimes overlooked when we go straight to intercourse. Sex and orgasm. Communication is most important. Take things slow and easy without pressure. Your body will respond differently now than it used to respond. Your brain is the largest sex organ. A lot of times people, when they have a chronic illness or a big change in their life, sex goes on the back burner and your libido is decreased. We need to be able to flip the switch with your libido. And like I said, the brain is the biggest sex organ. So it's about having, thinking about that again. Ideally, what I have people do is to take sex off the table for a couple of weeks and have 1 or 2 dates a week where they're actually looking forward and thinking about those dates. Just by doing that, you're starting to think again and, think about how things used to be, and that could help flip the switch. I also encourage people to try to think about connecting with their partner at a time during the day when they have energy and not at the end of the night when they're exhausted. That would make a big difference too. Sensation and pleasure areas, discover new erroneous zones. We talked about sensate focus. Remind yourself that sex should not be painful. And also, not all sex ends with an orgasm. There's a couple of fun facts that I have. A man can still have an orgasm with a flaccid or non-erect penis. A lot of people don't know that. And also, sex is different in your 20s, 30s, 40s, 50s, and so on throughout your lifespan. A book that I really like that explores sexuality throughout the lifespan is called Enduring Desire by Barry McCarthy. There are questions in that book that are really great to help build your intimacy with your partner that you can discuss. Sexual changes. You would probably notice some vaginal dryness. Perhaps you're in hormone deprivation or early menopause. There's a lot of controversy over using estrogen now, estrogen-based products, so I would talk to your oncologist about that. Vaginal atrophy, the vaginal muscle without use shortens. So people will sometimes commonly say it feels like if they're having penetrative sex, they're hitting a wall, and that's what they're talking about. You might have changes from lumpectomy, mastectomy, reconstruction. This will affect your body image and also the sensation. Maybe prior to your diagnosis, your breasts were very sensual, and now you do not have the sensation you had before. This again is the reason why we ask you to try like sensate focus to see what feels good again in your body. Nipple sensation could change, erectile dysfunction. There's medications for that, but some of the erectile dysfunction is actually caused by medications, weight gain, sedentary lifestyle, different illnesses that affect your circulation. There may be concerns with incontinence. Sometimes people have concerns with ostomy bags. So I would suggest different positions, maybe wearing a cami or a t-shirt, a tube top, a cummerbund. There are a variety of different supplies available to help make you comfortable. I did talk a little bit about estrogen earlier, but non-estrogen hydration would be like Hylogen, Gynotrof. These products, what they do is they hydrate the vaginal area. And so it feels like you're still getting estrogen, but you are not. And these are over-the-counter products. Uberlube is a lubricant. So there is a difference between hydration and lubrication. The hydration you use to make your vagina soft and supple again, so you don't have tears when you have intercourse. And you always want to use a type of lubrication anytime you put anything in your vagina after treatment, even a finger, even a suppository.
So as we transition into self-care, it's important to remember that, counseling and therapy are great resources to help you as you're navigating through. Sometimes there's a stigma around talking to a therapist, and it's important to know, especially here at City of Hope, that we're here to help make this journey easier. Yeah, we can teach you tools such as meditation, self-massage, even getting involved with like movement, physical activity are great ways for self-care. Getting outside. I have a couple patients that will go and sit outside by trees and said how grounded they felt. And it makes sense. If you think about a tree, it has that expansive root system that goes underground. So sitting next to one, you're feeling that connection to the earth. Qigong, yoga are great avenues through movement for self-care and really tapping into your own body's energy. And of course, laughter. We all say laughter is one of the best medicines. So it's finding those moments of levity in your day. Arts and crafts, taking a bubble bath, or even soaking your feet in some warm water or some Epsom salt are great ways too that can help the body decompress at the end of the day. Deep breathing exercises, and that's something simple that you can take with you. And it takes about 30 seconds to really take a nice deep breath and let it out. Listening to music that calms you, even creating that ambiance within your house. So you have maybe softer lighting, some of that relaxation music playing, maybe some aromatherapy or scented candles, and that makes a whole difference too for your body. And of course, practicing gratitude. So with that, it's, giving yourself some time to once again grieve those changes that you've experienced and also express gratitude for the things you might have learned along this journey or things that happened throughout your day that really made a difference for you. And if you've seen some of our other presentations, these self-care techniques may be familiar to you. These are kind of a staple for us because they're things that are easy to do. You can do that in the car, during a commercial break, if you're not watching a streaming system. So even as you're waiting for, dinner to finish cooking. So the thymus is a little gland that lives right where your collarbones uh, connect, and there's a little dip in your chest. And you can just gently tap that with a few fingers. And this is what helps stimulate your immune system. It produces T cells that move throughout your entire system. It's also a great form of relaxation as you're breathing and tapping. You can even close your eyes unless you're driving your car. And it's a nice way to reconnect with your body for that moment. The quick coherence technique is another great breathing technique that really helps your breathing and your heart rate connect back to each other. And it brings this balance back to you, especially if you're stressed or anxious, especially as we're looking at, the different body changes that we go through. This is a nice way for you to feel your heart rate just by putting your hand on your heart and another one on your belly and breathing into them. Just thinking about all the things that you appreciate about your body, especially as you've navigated through this journey. And of course, the ear massage too. So being able to rub your earlobes helps to release all the tension and stress that's in your neck. A nice way to experiment with this too is if you look as far as you can over your right shoulder and then look as far as you can over your left shoulder and rub your ears for about 30 seconds to a minute. And as you're rubbing them, continue to breathe and relax. Just noticing how you feel in the moment too. You might feel a little silly rubbing your ears. And you can pull them gently. Be careful if you have earrings in. And when you're all done, I'll challenge you to look over your right shoulder again. And your left shoulder. And see if your range of motion has increased. Because it should have at least a little bit, just because you're releasing all that tension and stress. So moving over to Cindy, she'll talk to you about some resources available.
Resources that I think are really important is the American Association of Sexuality Educators, Counselors, and Therapists. It's called ASECT. And the website is on there. If you're looking for a therapist in your area that also has training in sexual health, you can put your zip code in and it'll give you the therapists that are in your area that are qualified for that. And then you could just check with your insurance company to see if they're covered under that, if that works. Another resource I really like are different podcasts. And if you like podcasts, Sexology Podcast with Dr. Nazaleen Mawali is a really good podcast. She has probably over 350 podcasts, so you can just look and see what resonates with you. Previously, I did talk about the book Enduring Desire, and that's listed on here. Another really great book is Come As You Are by Emily Nagoski, and that is also available on tape. And then there's one more book I really like, and that is called A Better Normal, Your Guide to Rediscovering Intimacy After Cancer, and that is by Tess DeVez. I have some product recommendations too. Woman Cancer Sex by Dr. Ann Katz. She's been in this field for over 30 years with oncology and sex. So she is a wonderful resource. We did talk a little bit about low libido previously. There is a website here that you can go to get some additional information. I also talked to you about the vaginal hydration with Hylogen and Gynotrope. Those are listed, and Uberlube. So you can take a look at that and see if that would be helpful for you.
Thank you for joining us for this presentation. If you do have any questions, you're more than welcome to reach out to the cancer fighters, and they can get in touch with us to help you along your journey.